The next part is the opioid pharmacokinetics, which is basically about the disposition and fate of the opioid drugs in the body. So the pharmacokinetics begins with the liberation or how the drug is administered in the body. This refers to the different administration routes that include oral, parenteral, specifically the intravenous, intramuscular, and subcutaneous routes, and lastly the rectal route. The next are the four phases of pharmacokinetics, which are the absorption, distribution, metabolism, and excretion. So in absorption, all opioids are well absorbed orally, intramuscularly, and subcutaneously. Also, all opioids that are given orally are absorbed in the gastric and duodenal mucosa, and then transported in the liver via venous portal system. Not 100% of orally administered drug is distributed in systemic circulation. For example, the bioavailability of morphine would decrease to 30% to 40% since it would undergo first-pass metabolism. Some opioids are readily absorbed rectally, thus portion of these drugs do not undergo first-pass metabolism due to the route of absorption. The bioavailability of rectal opioids may be affected by factors such as rectal surface area, fluid availability in rectum, and the defecation or the excretion of waste. In terms of parenteral route, the most common sites are intramuscular and subcutaneous sites. The first pass metabolism is avoided. Also, there is no need for direct vascular access, and the drug absorption depends on the drug diluents. Next is the distribution. In terms of distribution, opioids have large volume distribution, or VD, thus they are well distributed throughout the body. Opioid receptors are widely distributed in the brain, however they are also found in the afferent systems, including sensory, limbic, and neuroendocrine, which contribute to the systemic distribution. In some cases, redistribution may take place for drugs such as fentanyl. Fentanyl is known to be a highly lipid-soluble drug, thus its constituents would easily pass through the membranes for redistribution. Next is the metabolism. Opioid metabolism primarily takes place in the liver. And since most opioids are advised to be administered orally, oxidation is the major metabolic pathway for most opioids, which occurs in the liver. There are two phases of metabolism. One is the phase 1 metabolism or modification reactions, and the second one is the phase 2 metabolism or conjugation reactions. In phase 1 metabolism, the modification reactions typically subject opioids to oxidation or hydrolysis, which involves CYP450, which is a type of hemoprotein. On the other hand, the phase 2 metabolism conjugates opioids to hydrophilic substances such as glucuronic acid and sulfate. Conjugation reaction, especially glucuronide conjugation, makes most of drugs more lipid-soluble and more easily excreted. The last phase is excretion. So many opioids such as morphine are excreted as metabolites through the kidneys. Others are excreted via bile such as methadone. There are factors that influence the renal excretion of opioids like glomerular filtration, tubular secretion, and tubular reabsorption.